which is this Gang of Six. You've seen this Gang of Six that they've been talking about. That's where that is based upon, is that Senate Finance Committee. They have yet to come up with a bill. They have a basic outline that's publicly available now, a basic outline of a bill, but they've yet to introduce a bill and take it to what's called a markup, which all the other committees did, a markup where they would amend and deal with the bill. So that Senate Finance Committee is the last one to deal with the bill. So if and when they do bring this bill, which may or may not have bipartisan support, which we know does not have a public option, which is likely to take which is going to take the cooperative approach to dealing with competition, that bill would then have to be reconciled with the health bill, and then that would have to go to the Senate floor for a vote. What I can tell you is that the House has decided, that the leadership of the House decided, is that they are not going to move forward with the bill until the Senate does, until the Senate votes on one bill. The House is tired of, quite honestly, is tired of voting on initiatives and passing initiatives and then having the Senate sit on them, and then having the Senate take them apart. So they want the Senate to pass a bill first. And so, obviously, again, the Senate Finance Committee taking so much time to have a bill is holding up the entire process. And if you'll see right now on the floor of the Congress, there's very little legislative activity planned for this week or any other weeks because they're in a hurry up and wait format because everything is dependent upon healthcare and everybody wants to get healthcare done. So that's where the standstill is right now in the House and the Senate. Now, President Obama, as you see, many people say that he doesn't have a bill, which is correct. He has never introduced a bill to the Congress, sent a bill to the Congress, really sent too much documentation to Congress, unlike the approach that President Clinton did many years ago by sending a bill to Congress and having them work off that format. He has yet to do that. After his speech last week, he still has not submitted a bill to Congress. So there is no Obama bill, to be clear, Obama administration bill. He has submitted a broad outline of ideas and goals that he would like in healthcare. So that's currently where things stand. Now let me explain one thing which people don't understand, is that after the House and the Senate, God willing, pass a bill, they have to go to what's called a conference committee, where the two bills should be reconciled, and then they have to get repassed by the House and Senate so that everybody has the same bill. At some point, all the bills have to be one. What people don't quite understand is that the House, just as an illustrative example, the House could pass a bill that's red, and the Senate could pass a bill that's yellow, and then they would come to conference and you would expect them to reconcile these two bills in something that's orange. But what they could come up with is something that's blue. So that's currently where things stand. I can tell you, as somebody who works for a member of Congress who's been very involved in healthcare, this has been going on for a long time. They've had many meetings about this. It's very detailed. Quite honestly, it is very difficult to understand. It is very lengthy. Most members of Congress and most staff here, quite honestly, don't have their arms fully around the bill because it's not a simple thing, nor should it be, because it's a very complicated measure. I'll tell you that we had town halls that members are very harried after having many town halls. We had a town hall that attracted about 1,250 people. Usually you send out a mailer to every person in your district begging them to come to a town hall and you get about 50 people. You're lucky to get 50 people. So this whole experience that members went through this last break was very different on this issue, and it's galvanized a lot of people. And what I saw just from the standpoint is that the people who are most loud about this are on both extremes of the debate, but the average American, and obviously by extension the average Muslim American, understands very little about this bill, And the media is giving them very little about this bill, and its understanding is very little. And the idea is, one thing to understand is that the comprehensive approach is all tied together. You can't simply just do insurance, generally the idea, you can't simply just do insurance reforms without talking about competition. You can't talk about competition in insurance reforms without talking about the fact of uninsured Americans. You can't talk about uninsured Americans.
Process and how we as communities of faith and people of concern can be effective in the redressal process.
Thank you so much. Assalamu alaikum. As Brother mentioned, my name is Asad Akhtar. I'm the president of the Congressional Muslim Staff Association and also the legislative director for Congressman Bill Pasquarello from New Jersey, who is on the Health Subcommittee of the Ways and Means Committee, which is one of the 3 committees in the House side that is dealing with the bill, and one of the 5-6 committees overall. So I'll explain the whole process. I'm going to speak about the legislative process, but I do want to say that, as other speakers say, that it's a fantastic initiative of the AMT to take this issue. It's very important that the Muslim community be seen as fully engaged as we are on domestic issues, as much as we are in international or other issues. It's clear that this is critical to us on both the service side, as in doctors, and the delivery side, as in constituents of America. We both give and receive health care at a very high rate in this country, and we have to be concerned about it. I will speak, and I know Congressman Ellison was ill today. I think that's why he wasn't able to attend, and I know the legislative director was here, so I'll be happy to speak on their behalf a little bit as well. But just basically the legislative process that stands, there's a lot of confusion about this bill. A lot of people ask me, well, is there a bill or isn't there a bill? And the answer is kind of. There's kind of a bill. There is a bill that has been passed in slightly different variations in 3 committees of the House. As I mentioned, my boss is on the Ways and Means Committee that deals in large part with taxes, had a large part to do with how the bill is paid for, and certain other components of it. The Energy and Commerce Committee, which is one of the primary committees that deals with healthcare, and the Education and Labor Committee. So these 3 committees in the House side have taken up the bill before August. You saw before August. They took up a bill, passed the bill with various amendments, and the problem is that before we went into recess in August, they never reconciled these 3 bills into one bill that would go to the House floor and be passed by the House. So to this point, the House of Representatives as a whole has not voted on any one bill. They have not all voted. So this criticism or complimenters of any member, most members have not taken a vote on this health care bill yet. And that's a very clear, important point to note. So this bill is still sitting on the House side, 3 different bills. The last committee, you may have heard a lot of talk about the Blue Dog Democrats and the changes they were making to the bill, the kind of drawn-out debate that happened on the House side before the August recess. That happened in the Energy and Commerce Committee. And the fact was that the Blue Dog Democrats, who represent more conservative elements of the Democratic Party, and our large caucus within the Democratic Party, represented a large number of members on the Energy and Commerce Committee, enough that they could have stopped the bill if they wanted to. So they held up the bill until the very last week of July, before the August recess, in order to get certain changes into the bill, one of which was a promise that they would not have to vote on the bill before the August recess. So they added certain elements to the bill. And now, so as I said, the bill has not been voted on by the House. On the Senate side,
August body, I see so many friends up here today. Healthcare is very serious. In the great Hoosier state, Indiana, we have seen over 100,000 fellow citizens lose their jobs in the past year alone. These numbers are shocking, they're disappointing, and it calls for us to do something greater. I impress upon my constituents all the time that this healthcare crisis touches everyone. It doesn't discriminate against race, it doesn't discriminate against religion, creed, but it is universal. I received a letter a few weeks ago from a constituent who was a survivor from breast cancer, and she had 2 serious surgeries, and she has a good job. But her greatest fear, because now they're cutting back, is that if she were to lose her job, she wouldn't have any coverage. This issue is so critical, and I think as a Muslim, proud American, I think now we have a great opportunity to move our position to the forefront. We want to talk about dawah. We want to talk about the promotion of the faith. We want to talk about proselytizing, which I think is some circumstances, but we want to talk about promoting the faith. I think this is dawah right here. The religion of Islam teaches helping the poor. In the month of Ramadan, not only is this a time of great introspection and reflection, but this is a time to become sensitive to the needs of the poor. As a very young man, my mother and I spent a short period of time in a shelter, and during that period, I saw many Vietnam War vets in that shelter, Salvation Army shelter, still there in Indianapolis. And for me, I don't think that we do enough in terms of meeting the needs of the poor. In my district, we have many great hospitals. We have Indiana University. Their cancer research efforts are great. We have Worcester Hospital. We have Clarion, St. Vincent's, and we also have a few physician-owned hospitals. Now, these physician-owned hospitals provide wonderful services to our constituents, but there's a problem because some critics say that how can physicians own hospitals and not be concerned about the bottom line? And as a result, criticism has peaked because some say that the physician-owned hospitals aren't providing enough charity care. This is a problem. You know, at the end of the day, most of us in this room are educated, come from great universities that are noteworthy, worthy to brag about. But the reality is this: 80% of Americans are without college degrees. Some will never go. People don't care what school you went to, because at the end of the day, if you aren't concerned about their needs and their suffering, what you've done, how you've matriculated, where you've been, doesn't mean anything. If we're not concerned about the least of these as spoken in the Bible, Prophet Isa, peace be upon him, said to his disciples in a meeting one day, he said, "He who wishes to be chief among you shall first be your servant." We must get back to serving people. We have to get out of this political battle and these emotional battles of Pakistan, Afghanistan. Though critical, we have to keep our attention on them because they're very critical. We have to get beyond the emotionalism, though critical, of the Middle East, though we got to keep our eye on it. But if we want to affect change, we have to start here at home. The reason why we're not really connecting as Muslims in this country is because people see too much attention, arguably. Yeah. Across the seas. Now, I know that there are dual allegiances. I respect that. But one of the things that I hear a lot in my district is that, you know, with so many qualified Muslim physicians, why aren't they out on the forefront in this healthcare debate? I wish I could take them to see this. This will probably be YouTube. Probably not a good idea. My opponents will use it. But, you know, the Muslim brothers help you out. They hurt you, but that's all right. But at the same time, a lot of people say, why aren't the Muslims out on the forefront of this issue? A lot of Muslim brothers and sisters who come from the Republican Party, quite frankly, could be speaking up on this issue, serious concerns. My district, overwhelmingly, a poll was taken a few weeks ago. The headline read, "Congressman Carson all alone in the healthcare battle," in relationship to my colleagues in the congressional delegation. Overwhelmingly, my district is for a public option. Overwhelmingly, my district is for a single payer. We're a little different there in Indianapolis, but overwhelmingly, they're for a public option. And that's critical because I have Eli Lilly, one of the largest drug companies in the world, headquartered there. WellPoint, headquartered in my district. Two of the largest employers in my district. Another large employer in my district, hospitals. And so even with these two juggernauts in my district, and we love Eli Lilly, they do a great job in terms of their innovation with biological meds and those kinds of things, and diabetes meds and medicines for mental illness. My mother suffers from mental illness. But even the district is for healthcare reform. I had a great time in August. Not only did I get to go to Iraq and meet with our troops and travel to Kuwait. When I was in Iraq, I met with a U.S. citizen, a troop, who expressed to me, one of my constituents, he said, "I fear when I go back to the States, Congressman, that I'm going to have to take care of my mother." I said, "Why?" He said, she suffers from a pre-existing condition. She suffers from mental illness. And because she has a pre-existing condition, she can't get coverage or the kind of coverage she needs. That's problematic in the wealthiest nation in the world. Here he is defending himself, defending his life. He went to the military because he didn't have any options. Young brother wanted a degree, family couldn't afford it, didn't have any other options, could have joined a gang, could have joined a supremacist group. He joined the military. Now he's over there fighting, he doesn't know why, but he has to come back and take care of mom. That's a problem. This healthcare debate is so critical. As members of Congress, we have our specialties. I come from marketing background, law enforcement background, intelligence background. I'm not a physician. As elected officials, you have to master generalities. because so much is coming at you each and every day. What I make an appeal to you all as experts to reach out to us, to educate us. I meet with physicians all the time. But you guys have a different perspective because you've seen poverty abroad and at home. You have a different kind of insight than we need. You have friends on Capitol Hill, but as Kucinich said earlier, if you're not engaging us, then you'll get lost in the shuffle. I think what you guys are doing, you're doing a phenomenal job, but we need a movement. Movement changes things. It's not enough for us to meet today. You guys make a report, go through your Roberts rules, and then we dismiss and do something else. We have to keep this thing going. You have some great leaders here who have access to mobility. Where's the Muslim sister up here? Respectfully. That needs to be posted on YouTube because we're fighting a PR battle at the same time. While we have experts in healthcare, we got to have a hijabi or at least a Muslim sister out here who's a physician or a nurse to represent the cause.
She's going to come and testify.
She better get up here double time. As long as that camera's on, she needs to be sitting up there. See, I'm a politician and a marketeer, and I'm sensitive to perception.
Sure.
So many people come in here, non-Muslims, wanting to know what's going on. They say, oh, chauvinism, sexism again. I'm out of here. I'm going to lunch. And we've lost the sale. See, so I want to thank you guys for what you're doing. I'm pressed for time, but I really want to go deep because I really want to know individually from each and every one of you because I'm sure you're all different. How do you feel about public option? Is it realistic? What do you think about co-ops? What do you think about single payer? Is it realistic? Is it a bunch of political talk? What do you think about a trigger? Letting the insurance companies do as they do, and if they don't meet the requirement, then the public option will kick in? Or is it another attempt by the insurance lobby to raise the bar, knowing that the insurance companies will never meet this, so they can do what they've been doing? We got to talk about these things. I want to know what you guys are thinking on these issues because I have to take it back to my constituents in my district. We have Muslim physicians who I've met with in my district and who I talk to, and you know, people are different. And I understand that when we talk about Gaza, causes a lot of emotions. The Muslims, large part, people think they're not going to do anything. We talk about disparities in Pakistan. Muslims get excited, but they're not going to do anything. The same physicians in my district who we've tried to engage, some of them, you got Harun Qazi and some other good people. But for the most part, they just want to live their lives. You see? We have to do more than just live our lives. We have to be active in the America that we claim to be proud of and a part of. Though problematic, though not perfect, arguably the greatest nation in the world. So I'm appealing to you once again to be a resource to me, to be a resource to us, to Brother Ellison and others, in educating Kucinich and educating us on what your concerns are. Because we can say, you know, we're here as physicians or here as medical experts, this isn't about Islam, but when it says the American Muslim Taskforce, how could we not incorporate the deen in our discussion? So I want to thank you and commend you for what you're doing. Keep up the great work. But remember, keep in mind, before we're too critical of elected officials, we are masters, or at least trying to master generalities. If you want specifics, there are a few physicians who happen to be members, but if you want specifics, we got to come to you guys. So open the door and educate us. Assalamu alaikum.
Because without health, all of the other rights that you would hope to enjoy could not effectively be enjoyed. And furthermore, to point out the importance of this idea of promoting the general welfare, the founders further put it in Article 1, Section 8 of our Constitution as being one of the principal reasons